most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob. Be careful.
Today we're going to talk about the single biggest mistake we see with knee replacements. People who are getting a knee replacement.
Yeah, that's a good topic so you feel prepared.
Right. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day.
That's right.
Also go to bobandbrad.com. We command you. And go to the giveaway section. We're always giving something away. This week we're giving away...
Oh, the Booyah Stick. I was just stretching my shoulders out with
This looks very simple device, but it's amazing what you can do for your shoulder.
Simplicity, but we use it
And
for
balance.
a lot of other things.
Go to Facebook. The contest will be pinned to the top of the page. Go to Twitter, Instagram, TikTok. If you want a 60-second version of our program.
Oh, I interrupted. Sorry, Bob.
Yeah.
The podcast. We are now podcasting away, and we've got some outstanding information coming out that way.
That's right.
But you're going to have to listen to us talk a little more there for sure.
All right. So we're going to go right into the single biggest mistake. We'll also talk about some less common mistakes.
Sure.
But we'll start out with the single biggest mistake. You pick out the wrong surgeon. And it's very simple. I want you to follow a couple rules when you pick out a surgeon for knee replacement. This is an involved surgery. You want to have somebody that's skilled.
Yeah.
So the first thing, when I was listening to a doctor who said, when you have small problems, you can go to a small institution, like a small hospital.
Right.
But when you have big problems, that's where you go for big institutions, more regional institutions, and maybe, like you talked about, clinics that maybe have specialized in knee replacement alone.
Right.
You know, they might be smaller, but that's all they do.
Right. Well, we've got an example here, the small town of Rockwell. We've got a couple thousand people. Well, they have one of the best knee surgeons in the nation there.
That's
people
right.
People go there from all over.
Everywhere.
Yeah.
Everybody around here knows his name, even though, what is it, 2 hours from here? Maybe more.
You mean Dr. Lawrence?
Yeah.
Yeah. Well, from here, it's about an hour and a half.
Okay.
Yeah.
All right. Anyway, you want to pick out a surgeon that has done at least, I'd say 50 to 100.
Oh, at least,
At least 100 surgeries of the knee replacement. It's all right if he does some hips and so, but he's done, or she.
Yep.
You want him to live, breathe, and sleep. Knee replacements.
And do not be shy to ask.
Right.
Just ask. Well, how many years have you been doing this? How many knees have you done?
Yeah.
And that's all.
That's very common. A very common question.
Yeah.
I mean, Brad and I, we can talk about how many knee replacements have we seen.
Oh, well, in the thousands.
Yeah,
over the last 25 years.
Right. Right. So we know what we're doing. I mean, you after you've seen, you start establishing patterns. You become very good at it.
Right. Knees are fun to work with. We like knee replacements.
They are. So don't hedge on this one. To get this done, pick out someone that's really done a lot of them, and you're going to be a lot happier with the results.
Sure.
So, all right, someone that are maybe a little bit less common problems. Before the knee replacement, you get a MRI or an X-ray of the knee, and they tell you that you're bone on bone, or your cartilage is worn away, or I don't know what else.
Well, which may be true. I'm sure what they're telling you is accurate, but sometimes people get too involved with that or get overwhelmed with it, and it makes things worse than it is.
Well, the point we're trying to make is, if you get older like us, make it to the old age, your knee is going to wear out.
Yeah,
that's just normal wear and tear. So when they say, your cartilage is thinned out, you got bone on bone, you have a narrowing of the knee joint, it sounds really scary. Like, oh my God, what did I do? I really damaged it. No, Brad and I could have X-rays right now, and we might have the same problem. We just don't have symptoms.
Right. Because sometimes people have two bad knees. They X-ray both of them or scan them, and say, oh, this one on the scan, it looks like a 85-year-old knee, and you say, well, that's not the one that hurts. It's the other one that hurts. And I've heard that many times.
Very common. They've done many studies on this. They did studies with 50 people without any pain, and they looked at a knee and they looked terrible. and then they did people with pain, and their knee looked fine. So it's you can't always go by the scan. Is what
Right.
I'm saying. So before you do a knee replacement, you should have some therapy, which involves stretching, strengthening, movement, maybe
Hmm.
decreased weight bearing, because you got to give it a shot because you may not need the surgery.
Right. And even if, therapy does not help, it continues to be painful. It's really a good idea to do the exercises, range of motion strengthening before you have surgery, because the chances are much higher you're going to have a better recovery and rehab after surgery.
All right. Okay, the last mistake we see, and after seeing thousands of people with knee replacements, this is the speech I give everybody the first day. So they've had their knee replacement. They come in, and I tell them that I want them to keep the pain under control. So
Sure.
take the pain meds as they need or ice. But the other thing that I really emphasize is that the number one thing you want to do is try to regain the motion.
Sure.
Your strength is going to come back. I almost everybody, the strength comes back without a problem, and so they'll come back and they'll be shown like 10 exercises to the hospital. I said those are all fine, but the one I really want you doing is that you're trying to get bend as
Right.
much as possible and straighten as much as possible.
Both directions are actually straightening it is oftentimes more important, particularly for walking, which that's what we're doing.
But there are, you'll find people that can straighten it right away and
Yeah.
then can't bend it.
Yeah.
You'll find it both ways.
Sure.
So really focus on movement. I usually have people work on moving the knee and stretching the knee at least 3 times a day for
Yes.
5 minutes.
Yep.
They can do it more. We often recommend using a knee glide. Brad, if you want to pull the chair over, I'm going to show it in bed.
Right, right.
So-
And this is one of those things that's going to be common with your surgeon. Any therapist is going to emphasize get that range of motion going as soon as you can.
What's nice about the knee glide, you can actually start working on it in bed.
Right. And you're more relaxed typically in the hospital. I've done range of motion with people on a
Yep.
hospital bed, helping them with their leg and knee and hip. It's a backbreaker
Well,
for
it's
the
a back-
therapist,
exactly.
and you're not doing any active range of motion with the knee.
when you have a painful knee, you want to be in control.
Right.
So
Absolutely.
this is going to allow you to be in control, and you can actually work on straightening. You can work on bending it. You could even take the other leg and help a little
Yep.
bit,
Yep.
and you can even take the other leg and put it on top, way like this, and push down a little bit.
Sure. Yep. Or someone can help you as a therapist. I know this would be, this is my buddy.
Yeah.
To make life easier for both patient and me.
Exactly.
And of course, Bob's got his shoes on and is dressed up, but you can do it.
Right.
And actually, without shoes on this works better when you're lying down.
Yeah, I sometimes you put a towel down.
Yep. A
just to-
folded up towel for
yeah.
a little cush.
So if you want to show it sitting in, Brad.
Oh, yeah.
Yeah.
Bob, there's one other thing while I'm getting this set up is a big thing that's supposed to be number 5
Sure.
is do not talk to other people who've
Right.
had their knee replaced.
I include that in my first speech too.
Yeah, because they'll have talked to people that had problems and it took
Yeah.
them 3 months to get their knee to bend, painful, blah, blah, blah. And then there's going to be other people. Oh, well, in 3 weeks, I was up walking and doing this and that, and you feel like you're behind because of it.
Right.
You cannot
And
compare.
every knee is different.
Yeah.
I tell people if they end up having the other knee done, it's going to be way different. It's either going to be better
Yep.
or way worse.
Yep.
And the other thing is people have really faulty memories, which I have found. And people think that it was either better or worse than they remember.
Yep.
And
Yep.
so they go, well, yeah, I remember I got my knee moving like within a week. And
Yeah.
like, no, you didn't. It was several weeks before you
You
got
were
it
in a lot
moving.
of pain that first week, and then it all of a sudden that happens. Sometimes, look at what we're doing here.
What's nice about the knee glide too, besides being able to do it in bed, you can put it on the stilt.
Yeah.
And
which
so
helps particularly.
gives a little gravity assist.
Yep, changes the angle of your ankle, which can help the knee. The other thing I like about it, you can, a lot of people will say, you can take a towel, which works well, and put it on a smooth, shiny floor, and that works well, but you cannot get the angle like this.
And you can't lie in bed with a towel.
Right.
So-
On carpet, then it doesn't. It's hard to do this on carpet unless you have something like this. I've had people use a plastic bag around their foot to
Yeah.
slide on carpet, or take a cookie sheet.
Cookie sheet.
Yep, they're a little cumbersome.
But what's nice about these is you can then use them later on. Like if you're doing desk work, you can just
Yep.
put it on your desk and
Yep.
and work on it.
Yeah, I had a
So-
patient. That's what he did. He said he worked on his desk. He had not an ACL,
ACL.
a meniscus surgery.
Oh, sure.
But he would just work at his desk and keep it going. Of course, not all day long, but every couple hours,
Sure.
keep it moving. So
all right, that's our advice to you for what it's worth. What is our advice worth?
our advice, actually, Bob, I think on this, I feel really confident. Chances are your knee is gonna come out very good. You're gonna say, "I wish that."
Yeah, most knee replacements do very well.
Yeah, I would say my personally 95%
Oh, at least.
do very well. Some take a little longer than
Yeah,
others.
some take a little longer.
There's an occasional issue one, but it's rare.
Remember, Brad and I can fix just about anything.
Oh yeah, that's right. Except for,
A broken heart.
but we're working on that.
We're good on knee replacements, though.
I'm thinking, well, yeah, but we got to get another chapter in the book that relates the knee to the heart. I don't know where that chapter is coming from. I'll think about it tonight before I go to bed.
I know what you feel
Let's-
like because I don't know what you're coming from now.
Let's cut before it's too late.